Guys, we're going to talk about Chapter 7, and this is just going to work through that nursing process and standard of care. The nursing process should be review for you, remembering that that's our framework as nurses. So we're going to get started here. So when we think about quality and safety for our patient, this has really become an essential focus for education. These competencies describe essential features of a competent and respectful nurse. All nurses should possess the ability to provide patient-centered care, work in multidisciplinary teams, employ evidence-based practice, apply quality improvement, and utilize that informatics. The nursing process is a 6-step process that provides a framework for problem solving. Again, this should be review for you. The intention for the nursing process is to facilitate and identify appropriate, safe, culturally competent, developmentally relevant, quality care for individuals, families, groups, and communities. So as we look at this framework, this is an ongoing, and each encounter with a patient or client will involve some type of assessment. And that's the first step, is assessment. So who's going to perform these assessments? It could be the nurse, it could be the physicians, maybe a psychiatrist, social worker, dietitian, or even other therapists. Who's the primary source of this data? And it's clearly going to be our patient. But if the nurse is unable to obtain information, from that primary source or the patient, can we obtain from other sources? Absolutely, we can. If our patient is in a psychosis, they're agitated, they're catatonia, we're going to have to get that information from somebody else. So who are some of those secondary sources of data that we can talk to? That might be a family member, a friend, maybe the neighbors, maybe the police, medical records, or other healthcare providers. So what is this assessment actually involve? The assessment gives us the ability to collect and synthesize pertinent patient data according to our HIPAA guidelines. We do have to be mindful of the age of our patient. When we're assessing our children, we might need to consult the caregivers. That's that secondary source. We may need to use interviews or maybe observation and play. With adolescents, we might need to explain the need to share some information with other adults. Risk factors always have to be our priority. With our older adults, we want to avoid dismissive stereotyping. We need to identify and accommodate for physical defects up front. Excuse me, if there are language barriers, we may need to use the use of an interpreter or a translator. When we define interpreter, that's someone who interprets the spoken words of a foreign language speaking person, or someone that might use the American Sign Language. A translator is the individual who speaks one or more languages in addition to English, who translates the written word. So just understand what the differences there between interpreter and translator might be. So the purpose of a psychiatric mental health nursing assessment is to establish rapport, right? We want to make sure our patient trusts us, understand the current problem, review physical baseline status, identify any risk factors. We may be performing a mental status exam, assess psychosocial status, identify mutual treatment goals, formulate that plan of care, and then document any data that is retrievable. So as we start gathering our data, we want to review the systems. Nurses are going to gather vital signs, historical and current review of body systems, and document any allergies. Many symptoms of depression, anxiety, and psychosis are often associated with physical conditions. So it's really important that we rule out those physical causes of symptoms so that we can get to the source of the symptoms the patient is experiencing. When we think about laboratory data, hyperthyroidism can mimic depression. It can also share symptoms that look like anxiety, weight loss, and insomnia. Abnormal liver enzymes can explain irritability, depression, and lethargy. So as we're obtaining those lab data, it can help us differentiate between physical disorders and psychiatric disorders. Page 114 in your book has a really great chart of psychiatric symptoms that are associated with medical conditions. The MSE, or mental status examination, helps aid in collecting and organizing objective data, such as our heart rate, blood pressure, temperature, height, weight, and observational data, such as what is their communication, how is their appearance, what is the speech pattern, mood, and affect. When we think about our psychosocial assessment, this helps with psychosocial data of the patient. This may include patient perceptions and recollection of current lifestyle, support, coping styles, and spiritual and cultural beliefs. Spiritual and religious assessment helps us understand the influence on how people understand meaning and purpose in their lives and how they are able to solve problems. Cultural and social assessment, nursing plans should cater around those unique cultural healthcare beliefs, values, and practices. And then once we have all of our assessment data, it is useful to summarize and review that data with the patient. This summary provides the patient with reassurance that they've been heard, and it gives them the opportunity to clarify any misinformation. So we're validating all of the assessment pieces that we've just collected. The second step in the nursing framework is analyzing the assessment findings. So analyze assessment data to determine diagnosis, problems, and areas of care and treatment focus, including levels of risk. Diagnostic statement components include potential problems, which are unmet needs, probable causes, which is our to-do, and supporting data, so signs and symptoms as evidenced by. The problem or unmet need describes the state of the patient in the present moment. This nursing diagnosis indicates what we should change. The probable cause is linked to the diagnostic label with the words related to. This usually indicates what needs to be addressed to bring about the change with nursing interventions. And then the supporting data includes signs and symptoms that may be linked to the diagnosis with words such as evidenced by. So let's look at this a little bit closer here. Problem-focused diagnosis is a judgment of undesirable human responses to a health condition. This type of statement will contain the problem, the probable cause, and supporting data. So for example, if our patient has anxiety, the problem is anxiety. It's related to the probable cause, which might be loss of employment and a financial burden. And the evidence that we see, or the supporting data that we might see, is that patient stating, I can't concentrate, they're crying, they're restless, or maybe they have some insomnia. So our statement, our nursing diagnosis statement would say anxiety related to loss of employment and financial burden as evidenced by patient stating, I can't concentrate, patient crying, patient restless, patient insomnia. Our risk diagnoses focuses on probability of developing a problem. Common problems in this category include preventable occurrences such as falls, self-injury, pressure ulcers, and maybe even infection. This statement includes the problem and defining characteristics that put them at risk. So let's say our patient is considering suicidal ideations. So they might be at risk for self-mutilation as evidenced by inadequate coping, isolation, or unstable self-esteem. So those are the two different nursing diagnoses that you will see in kind of our psychiatric setting. The third step is outcome. When we talk about outcome criteria, we're identifying expected outcomes that reflect the maximal level of patient health that can realistically be achieved through planned nursing interventions. Principles of outcome include the reflecting of measurable desired change, provide direction for continuity of care, and written in positive terms. Outcomes often provide both short and long-term goals. These are goals we expect for the individual's plan of care. Outcomes do have to be SMART, specific for our patient, measurable, attainable, realistic, and time sensitive. The fourth step in our nursing process is planning. The planning phase provides strategies and alternatives to attain the expected outcomes for our patient. After assessment and formulated diagnosis with analysis, then prioritization occurs. Safety always comes first. Interventions must be safe for the patient, other patients, and family. Evidence-based interventions and treatment is the gold standard in healthcare. Evidence-based practice for nurses is a combination of clinical skills and the use of clinically relevant research in the delivery of effective patient-centered care. Using the best available research, incorporating patient preferences, and making sound clinical judgment and skills provide an optimal patient-centered nurse-patient relationship. The next step in the nursing process is implementing the identified plan. So registered nurses' interventions can include coordination of care. Nurses have the most contact with the patients and can communicate the patient's status, needs, and goals. Nurses also tend to be the patient and family advocate to help them navigate the healthcare system. They also can intervene by health teaching and health promotion. These are adapted to the patient's special needs and recovery goals. Pharmacological, biological, and integrative therapies. Nurses must be knowledgeable regarding current research findings, intended action, therapeutic dosage, adverse reactions, and safe blood levels of medications being administered. And we have to create a milieu therapy. Milieu refers to a physical and social environment. Milieu therapy is a psychiatric philosophy that involves a secure environment, including people, settings, structure, and emotional climate to support that recovery. Milieu therapy takes naturally occurring events in the environment and uses them as learning opportunities for our patients. Therapeutic relationship and counseling includes the basis of nurse-patient interactions. It provides the presence and sounding board, reinforces our healthy behaviors, helps the patient to recognize maladaptive behaviors, helps our patient identify positive coping methods, and tries out new coping methods. That's that therapeutic relationship and counseling. When we think about advanced practice interventions, consultation is an advanced practice role. Consultation involves assisting other registered nurses and members of the interprofessional team in addressing those complex clinical and other situations. Evidence-based information, clinical data, and theoretical frameworks provide the foundation for nurse consults. When we talk about prescribing authority and treatment, again, this is an advanced practice intervention and can be accomplished by evidence-based treatments, procedures, therapies for healthcare consumers. And then psychotherapy is conducted by the psychiatric mental health advanced practice nurse and can be individuals, it can be groups, couples, family psychotherapy using that evidence-based psychotherapeutic framework. And then the final step of our nursing process is evaluation. So evaluate the progress toward attainment of expected outcomes. This is ongoing evaluation of data that allows for revisions of the nursing diagnosis, changes to more realistic outcomes, or identification of more appropriate interventions if those outcomes are not met. Documentation is huge. It's referred to as the 7th step in our nursing process. This is the medical record and legal document. It's also important to document any non-adherence to the treatment plan. The important terminology here, the term non-compliant is usually judgmental. It's invariably judgmental. So a much more useful term is non-adherent. This term encourages healthcare providers to find out what's going on in the patient's life and explore those barriers, either to taking medication or participating in treatment. So try to remember that that verbiage there. Try to use non-adherent versus non-compliant, because non-compliant can seem very judgmental. And that concludes Chapter 7 over the nursing process. If you have any questions, you can shoot me an email or we can chat about it in class. Thanks, guys.